This is Mike Butz with MB Health Insurance Agency, here to talk a little bit or have some tidbits about health savings accounts, or otherwise known as an HSA. An HSA, really, and to talk about is the advantages of what they are, but how to use them. And they can be quite advantageous. They are the last great tax advantage savings vehicle that you and I have as consumers. So some people get a misnomer. So you have to have an HSA. You must be covered by a qualified high deductible health plan. So just because you have a high deductible plan on your health insurance does not mean you're eligible to open an HSA. It must be a qualified HDHP plan. That's high deductible health plan. The kicker about the health insurance is that during the deductible, you can have no copay. You don't have any copay benefit. You don't have an office copay. You don't have a prescription drug copay. So the HSA health plan says, whatever my deductible, I'm responsible for those expenses. Now, having that plan design should lower your monthly premium. That is your fixed expense to pay month in, month out, just to be insured for catastrophic care. In addition, is you'd want to put money into a qualified health savings account with your area bank or credit union or someplace where you would go to it. The government says the money you put into it goes in tax deductible, and then you can use the money immediately tax-free to pay for your qualified healthcare expenses. So the best way to use an HSA is to open it as soon as possible and begin monthly systematic accumulations. You have the option to wait until after you have a claim. Maybe you have a $1,000, $2,000, $3,000 medical expense. Put the money in your HSA, pay it from the HSA, therefore it became tax deductible, and then came as a tax-free distribution to pay that bill. Some people find it advantageous to do this on a monthly basis. Begin a $100, $200, $300 a month contribution. So in other words, it builds up a savings account when I have my prescription or a doctor visit or a covered surgery. So you can do this before or after a claim. You have until April 15th to fund your prior year's HSA limit. In other words, you have until April 15th of the year 2023 to pay for your 2022 HSA contribution if you were covered by a high deductible health plan in 2022. To continue your contributions, you must stay in an HSA, a high deductible health plan. So in 2023, if you qualify for Medicare, you may have a limited use of your HSA for that time when you coordinate with Medicare. So there are a lot of advantages that go with it. And the biggest advantage is the tax-free nature of the money and the lowest health insurance premium to be covered. If you have any questions or want to talk about this further, call our agency or contact us. Our phone number is 314-544-5400 or mbhealth.com.